Shari and Taylor, how are you doing?
Good.
That's good. So how can I help you both today?
Taylor has quite a bit of crowding. We've been to her local dentist and they've recommended that we get x-rays, and when we went to the specialist they said that her eye teeth weren't going to come down. So they have started to come down, but it's quite crowded up in the roof of her mouth there.
Okay.
She doesn't have a lot of room, and they've said maybe in a few years we could do braces.
Okay, good. And do you know much about how we do things here at MRC?
No. Not
Okay,
really.
no worries. Well, we'll get you well educated by the end of today. Now, what I'm going to do first for both of you is play a short video which will explain to you a little bit more about what we do, and then we'll take it from there after.
Hi, I'm Jackie, and today we're going to learn about something that's really important for your child's teeth and face. Did you know 3 out of 4 children have crowded teeth and incorrectly developing jaws? These problems can be evident to many parents in their children from as young as 3 to 5 years of age.
Okay, any questions from either of you so far?
No,
Not so much?
really.
Okay, no problem. So, as you found, the old traditional approach has been to wait until all the adult teeth come through. And often it's to take out these premolar teeth, which are these side teeth here, and use braces, like so, to stretch the rest of the teeth around the jaws. This is despite the fact that we can see the problem as young as 5 years of age. So even though we can see a developing form of crooked teeth as young as 5, the old traditional way has been to wait until all those adult teeth have come through. Now, in terms of limitations of that old approach, the first one is that once the braces come off, a piece of wire needs to be glued on behind the teeth for life, and or plastic molds need to be worn over the teeth for life to keep the teeth straight. And the reason for that is because the causes of the crooked teeth haven't been looked after. So this is a good illustration of the different causes of crooked teeth. And the big guy here is the tongue, and it can push up to 500 grams of force on the teeth. And the lips and cheeks here can exert up to 300 grams of force on the teeth. So Taylor and Shari, how many grams do you think it takes to move a tooth? So if the tongue can push 500, lips and cheeks 300, how much do you reckon it takes to move a tooth? Shari?
Probably about 800.
800, that's actually quite a common guess. What about you, Taylor?
150.
150. Look, you actually got a bit closer than your mum. But both of you were a fair distance off. It actually only takes 1.7 grams per centimetre squared of force to move a tooth, to move a front tooth. So you can see that if you don't control the way the tongue or the lips and cheeks are behaving, you're not going to have any hope of those teeth staying straight for life. Does that make sense? Yep. So in terms of some further limitations of that old traditional approach, first one we have here is what we call enamel damage. And that means that the sites where these braces are glued onto does affect the enamel irreparably. So once enamel is gone, it's gone for life. Also, the research has shown that 100% of these orthodontic cases can expect what we call root resorption. And root resorption means a dissolving away of these roots at the end there. And that's because the forces are different to the way we do things here. Relapse is what we discussed. So relapse just means those teeth going back to being crooked because the causes haven't been looked after with that old approach. And that's why retention is needed for life. So the retainers are the wire glued on behind the teeth for life, or those plastic molds worn for life. So we do use braces here, but only typically in less than 5% of cases, and that's normally if they're older patients and also if they haven't been so compliant with our Myobrace form of treatment. So typically we don't need to use braces, and if we do, it's normally only for about 6 months or so. So these side effects are not going to be anywhere near as pronounced if we use braces here because we're using them for a shorter period of time. Make sense?
Yeah.
Yeah, good. So one thing I noticed with Taylor already is that she's got what we call a reverse swallow. And that means every time she swallows, that little muscle under her lower lip moves, it contracts. And that's pushing back on her lower jaw. So even without looking inside the mouth, I can tell you that she'll have what we call an overbite, which is a vertical overlap of the front teeth, or an overjet, which is the horizontal discrepancy between the front teeth, and probably some crowding in her lower front teeth as well. So Taylor, can you just open there for me, please, and bite together on your back teeth. So you can see there Taylor has both the overbite and the overjet, and just open slightly for me. Open a little bit, that's it. And you can see she's got those crowded lower teeth there as well. And that's all to do with that muscle pushing back on those lower teeth. So it's normal to have an overbite and overjet, but only of 1 millimetre. So Taylor has more than a 1 millimetre overbite and overjet. And that's all to do with that swallowing with the muscles in and around that lower lip. So here's a video example of a reverse swallow. Now look at her face here. Do you see all that movement there? Now the face should actually be perfectly still when you swallow. There shouldn't be any movement at all. And part of what we do here is to train the kids how to swallow correctly so that we can actually look after that muscular cause of crooked teeth. Does that make sense?
Yes.
Good. And in terms of growth as well, this animation shows you what normal growth is, which means that the jaws grow in a downwards and forwards direction. But if they breathe through their mouth, for example, Taylor, where do you think your tongue goes when you breathe through your mouth? If you just open your mouth and breathe through your mouth, is your tongue at the top or bottom? Bottom, exactly. And do you know where your tongue should be by now? At the top, very good, that's it. So if the tongue is not in the roof of the mouth where it should be, then the direction of growth heads in a downwards and backwards direction rather than a downwards and forwards direction. Does that make sense?
Yeah.
So the tongue being in the roof of the mouth promotes a more forwards direction in the growth, which is more desirable for facial aesthetics.
It makes a big difference.
It does, doesn't it? That's right. And it's all, the development of the bone is all influenced by the way the muscles are behaving. And as I mentioned before, Taylor swallows with that contraction of the musculature under her lower lip there. That's what we call a reverse swallow. So you can see here in this skull that the proper development of that lower jaw has been held back because that muscle is pushing back on that lower jaw. So that means that there's less room for the teeth as well. And also the jaw isn't allowed to develop forwards as it should, which results in an overbite and overjet.
Okay.
Make sense, Taylor? Yep, good. And increasingly these days, we're seeing jaw joint problems in younger and younger kids. And the cause is the same. Swallowing with that musculature under that lower lip pushes that lower jaw back in the joint and puts some pressure on these joints here. So previously we were seeing that in older patients, but now because we're seeing more and more forms of crooked teeth, we're seeing these jaw joint problems manifest in a lot younger ages now. So it's best to get this stuff sorted now before it gets more severe later on in life, and to prevent these jaw joint problems later on in life as well.
Okay.
And here's another example. Basically, when you swallow, that bone there shouldn't be pushing back into the skull here. If it does, due to that swallow, then it causes some pain here, which can also manifest not only in the jaw joint area, but also in headaches, neck pain, and back pain as well. So it has overall systemic manifestations as well.
Wow.
Yeah. It's not something that you consider all the time, is it?
No.
No, that's right. So the principle here at MRC is that we treat the bad muscular habits not only to allow the teeth to straighten, but also to allow proper development of the jaws and the face.
Okay.
Because those muscular causes are responsible for both development of the face and crooked teeth as well. So Taylor, the correct position for the tongue again, where is it?
The top.
Up the top, very good. So when the tip of the tongue is up there, then the front part of this upper jaw is allowed to develop as it should. And eventually we want the whole top of the tongue, or the whole body of the tongue, up there as well. And that makes for a nice broad upper jaw. Does that make sense?
Yes.
Yeah? Yeah. And mouth breathing as well. We spoke about that a little bit earlier. Have you noticed that Taylor mouth breathes at all that you've noticed?
Maybe a little bit.
A little bit?
At night time.
At night,
when
yep.
she's asleep.
Right, so you notice
Not
her
that
lips
I've
drop
noticed.
apart
Yes.
sometimes? Yeah, okay. So, as we mentioned before, when you breathe through your mouth, your tongue drops to the bottom and the cheeks have enough power to make the upper jaws narrow. So that's what causes crowding in the upper jaw. If the tongue's not up there, then the cheeks have enough power to crowd those teeth up and narrow the upper jaw, just like that. Now, in terms of the overall health effects of mouth breathing as well, it's a pretty simple concept to understand in that the nose is made for breathing and that has a filtration system. But when you breathe through your mouth, the unfiltered air hits the back of the respiratory system and that can cause things like enlarged adenoids and enlarged tonsils. I noticed in the medical history that Taylor doesn't have a history of respiratory illnesses, which is good, but it's good. The fact that she may be a habitual mouth breather means that it's good to get on top of these issues now to prevent respiratory illnesses later on in life. And this system treats that as well by converting the mouth breathing to the nose breathing. So it's not the traditional way of thinking that crooked teeth are caused by big teeth or too many teeth or small jaws. It's actually caused by the way the muscles work around the face and also the tongue as well inside the mouth.
She did used to suck her thumb.
She sucked her thumb as well?
Yeah,
okay.
Right up until recently.
Yeah, right, okay. And how long had she sucked her thumb for?
Since she was an infant.
Since birth, okay, yeah. So with thumb sucking, what happens is the tongue is encouraged to be at the floor of the mouth and a lot of force is placed on that upper jaw because the cheek muscles here actually push on the jaws and narrow the jaws from the side as well. But again, that's easily fixed. We can reverse the damaging effects of the thumb sucking as well.
Okay.
Yeah. So, we've talked about the causes of crooked teeth, so what are we going to do about it? Well, the first thing we use are what we call Myobraces. So I'll give you each an example of these Myobraces to hold on to. So we have quite a large range of different Myobraces and they all do slightly different things. But what's common to all of them is first of all this tongue tag here. And that tells the tip of the tongue where to sit. So Taylor, that's exactly where that end spot is. So it teaches you exactly where to position the tip of your tongue. And the rest of it acts on the surrounding muscles. So especially that muscle underneath Taylor's lower lip there. Okay. So it's a pretty simple concept, not acting on the teeth themselves, acting on the muscles that surround them. Yeah.
Okay. And do they wear this all the time?
That's a good question. No, it's only for 1 hour during the day and while they sleep at night.
Okay.
Now, also, it doesn't need to be worn for an hour to stretch. It can be broken up into half an hour and half an hour if that's more realistic for you as well.
Okay.
Yep. Yeah. And a big advantage for you, Shari, is that Taylor can't talk with it in either. So it's quiet time.
Maybe longer than an hour.
That's right. Yep, that's right. Whatever your mum wants, Taylor. Now, towards the end of treatment, we go on to our aligner appliances. So, I'll give that to you there, Shari. And you can see that one has little slots for the teeth in there.
Okay.
So that's our replacement for braces. That gives us our final alignment. And as I said, it's about 95% of patients that can get away with just using our Myobrace system. Only a small 5% need braces for final alignment. And if we do need braces, that's fully covered in the fees, and it's typically only for about 6 months. Or less. Yeah, it does. So, in terms of the way the appliances work, the ones that Taylor has there, this softer one, we start off with what we call habit correction, which is to correct those muscular habits, correct the way the tongue's behaving and the way the lips and cheeks are behaving. Now, this one here, the stiffer one, actually acts on making the jaws wider. So we call that arch development. And then the one that you've got there, Shari, acts on the alignment. So we start off with the causes and then work our way towards the alignment. But right throughout the appliance range, they all focus to a degree on correcting those muscular habits as well.
Okay.
So by correcting these muscular habits, we make for a much more long-term and stable result, which is why most of the time we don't need retainers for life if we can overcome their muscular habits. Does that make sense?
Yeah, I wasn't aware that you needed to wear a retainer for life.
Yeah, that's right. Not many people know that, but nowadays it's mandatory for all traditionally minded orthodontists. 100% of the time, once braces come off, because those causes haven't been looked after, those retainers need to be worn.
Wow.
Yeah. So it's around the age of 8. How old are you, by the way, Taylor? 10. Yeah. So around the age of 8, we normally find that the patient's upper jaws are actually too small for the tongue to comfortably fit up there. So Taylor definitely fits into that category there. So we find that we need to widen these jaws just so that the tongue has enough room to sit where it should. Does that make sense? Yeah. So we use 2 types of appliances to widen the jaw for the tongue. The first is on the screen there, called the BioBlock, and this is another example of it here. And this is one that's removable, so you can take it out and put it back in. And we have another one here called the Farrell bent wire system that just sits behind the teeth, and this one's fixed into place. So they both do essentially the same thing, which is to widen the upper jaw so that the tongue has enough room. And as for which one Taylor receives, that depends on a proper diagnosis that we'll have to do at the end.
Okay.
So I will say that she will most likely need some form of expansion of that upper jaw, just so that the tongue has enough room. And then after that, she'll go on to the Myobraces.
Was that then allow the extra room for those eye teeth to come down?
Exactly right. Yeah. So it's enough room for the tongue and enough room for all the teeth as well. That's right.
Wonderful.
Yeah. We also have some other what we call specialty appliances, especially this lip trainer here. Now I've noticed that Taylor has had her lips together throughout this presentation, which is good. But some children, yeah, but some children do need some help to have what we call proper lip seal, to keep their lips together. So we have some appliances like this called the lip trainer, just to further strengthen the lips as well. So we have a lot of weapons at our disposal in order to overcome any type of form of crooked teeth or any type of bad muscle function as well. We also have what we call Myobrace. Now, Taylor may or may not require this. These are basically, and we've got an example here, they're basically little bits of filling material on the lower baby teeth. And if the lower jaw is too far back, like we have in Taylor's case here, this will just encourage that lower jaw to come forward a little bit quicker.
Okay.
Also, some people have what we call a class 3, which means that lower jaw is in front of the upper jaw like that. So the same sort of thing, we can pop these little bits of filling material or Myobrace on those lower baby molar teeth to encourage the upper jaw to develop as it should. Now, while these Myobrace are on the teeth, we also get them to wear a Myobrace as well.
Okay.
So that's another thing up our sleeve to be able to correct different types of crooked teeth. Now, we've also recently developed this appliance selector, which is a great new feature just to basically give you an idea of the type of treatment and the type of appliances that Taylor is going to need throughout her treatment. So, in terms of age, you're 10, aren't you, Taylor? So we'll pop you in what we call the late mixed, which is her stage of development here. And we're going to use the advanced Myobrace system because you're such an advanced girl, as I can see so far, Taylor. Does she require additional arch expansion? So arch expansion means, does she need her upper jaw to be widened? And I would say yes.
Yes.
So we'll click yes there. So this straight away shows you what she needs throughout treatment. So she would most likely, now as I said, this is pending the proper diagnosis that we're going to make at the end. But at this stage, it looks like she will probably be using this soft one to start with, called the Myobrace K1. And to widen her jaw, at 10 years of age, we would probably use that Farrell bent wire system, which is this wire that sits behind those upper teeth. Now, Taylor, the good news is, now I've had this in myself as well actually, and the good news is I didn't lose any friends because the wire sits behind the teeth. You can't see it from the outside, okay? Another big advantage of this one is that it can be worn in conjunction with the Myobrace. So while the wire is pushing the teeth out of the way, the tongue is encouraged to get up there and expand the jaw, expand the actual jawbone. Does that make sense?
Yes.
Yeah. And then we move on to the stiffer one to further promote expansion of the arches. And then we move on to the aligner appliances. So the one that you had there, Sherry, the one with the 2 slots. And then at the end, we do have a form of retainer as well, called the T4. But this doesn't actually retain the teeth, this retains the muscles. So it's a clear distinction. Now this is not something that will need to be worn for life in most cases. This is something that needs to be worn as a retainer until all that muscular dysfunction is fixed. So once the muscles are under control, then we can start to phase out the Myobrace use. And hopefully the teeth should stay straight for life if her musculature stays behaving correctly for life as well.
Okay, so if the tongue stays in the roof of the mouth.
Exactly right, and they're swallowing with no movement.
Okay.
Exactly, you've got it, Sherry. So as I've described to you so far, the first part of treatment is the Myobrace system. The second part is the arch development, the arch expanders that we sometimes need to use, and we will probably need to use those in Taylor's case as well. A third part to our treatment, and a very important part, is what we call the Myobrace activities. So these are activities, exercises, or games, if that sounds more palatable to Taylor. And these need to be played for about 2 minutes every day. And they're basically just to train Taylor's tongue and lips and cheeks to work correctly when she doesn't have the Myobrace in. So the Myobrace here is just an aid to help her muscles function correctly, and these exercises are there to make sure she can function correctly when she doesn't have the Myobrace in as well.
Okay.
Yeah. Now, there's an Achilles heel to every intervention, to every treatment. Now, this treatment does look after the causes, and it does make for a better face as well. But the Achilles heel of this is that it relies on Taylor to wear this for 1 hour every day and overnight. So if she does wear it, as she should, she'll get the best result for the teeth and the face, and a longer lasting result than the traditional old approach. If she doesn't wear it, there won't be a result. So it's as simple as that.
Okay.
So for certain kids who aren't willing to put in the work, then sometimes we do need to use braces to finish off. But as I said, most kids don't have a problem with using the Myobraces, and we can normally get away without braces to finish off.
I think we can do an hour a day, can't we, Taylor?
I think so. So, as I said, we do use braces here, and we have a special Myobrace that goes over the braces as well, but at Taylor's age, I don't expect that she will need braces if she's willing to put in the work that she should. So in terms of our treatment goals, the first thing that we have to establish is breathing through the nose. Now I can see Taylor is doing a pretty good job of that at the moment, but as you said, Shari, she may be a mouth breather. If that's the case, it looks like it's probably just a habitual thing, so that's something that we can easily overcome with our breathing exercises. We want our lips together at rest, which Taylor has sorted already. Correct tongue position, which is where, Taylor?
At the top.
At the top. We want no mentalis activity on swallowing. So mentalis is the muscle that sits under that lower lip there. So we want to make sure that when she swallows, there's no movement around that face there. And when we have these sorted, these first 4 points, then that makes for optimal facial development. So it allows the face to develop as it genetically should. And what we call class 1 occlusion, which means that 1 millimetre overbite and overjet, which is what we're striving for. Straight teeth as well, which is a bonus of getting rid of those muscular causes. And then we're going to strive for having no retainers as well. Now, so if she does put in the work and does overcome her own bad muscular habits, then hopefully we should be able to get away without those retainers for life.
Oh, okay.
Yeah. In terms of the treatment action, so these are Taylor's responsibilities in order to get a successful result. The first thing is that the Myobrace has to be used for 1 hour each day and overnight. So as I said, it can be broken up into half an hour sessions if need be. Regular daily use is very essential. And the reason is because, Taylor, when you have the Myobrace in during the day, you have to consciously put your tongue on that tag there and really focus on keeping your lips together. But when you're asleep, you don't know what your tongue or what your lips are doing. So that daytime use for that 1 hour is essential, is really important to make sure your muscles are working correctly, and then your muscles will work correctly during the night as well while you're sleeping.
And do the kids usually leave it in overnight? Like, does it stay in?
That's a very good question. It's typical for it to fall out for the first few weeks because the muscles aren't used to having it in, but with that increased daytime use, then it tends to stay in all night after that.
Okay, so the more you use it, the more likely it is to stay in.
Exactly
overnight.
right, exactly
Okay.
right. So we also want to do at least one Myobrace activity per day, and we'll coordinate exactly what exercises or activities or games Taylor will need to play every day as well. The Myobrace, the mouth should be closed when the Myobrace is not in use. So that basically means when you don't have the Myobrace in, Taylor, your tongue should be exactly where that tag was, and your lips should be together. So the whole goal of this whole treatment is to make sure you're doing what you're doing now, which is the lips together, the tongue in the right spot, but also swallowing with no movement around the face there as well. We want the tongue resting in the upper jaw, and we also need to see Taylor typically every month during treatment for about 2 years. We say count for about 2 years. Sometimes we like to see her more often than that if she needs more work in terms of her muscular exercises, those Myobrace activities, but typically it's monthly visits. And we also want to have good nutrition and a hard diet. And the reason for that is the whole cause of the muscles not working correctly is that with our modern westernized diets, the muscles that we need to swallow aren't developed fully. So getting her on a hard diet is going to just make the process a lot easier for her and train her muscles a lot easier.
That'll be the hardest one, I think.
Yeah, that's right, that's right. Okay, so in terms of the dental alignment for Taylor here, we'll just have a look in there, just open and bite together for me. That's it. So there's crowding in both the upper and lower jaws. And this actually looks pretty similar to Taylor here actually. We've got crowded upper and lower jaws, and the reason for the crowded upper jaws is basically the tongue's not in the right spot, which has allowed the cheeks to narrow that upper jaw and cause the crowding, and she's swallowing with movement under that lower lip, which is pushing back on those lower teeth and crowding those. In terms of her bite, what's normal, as I said, is for that 1 millimetre over bite and over jet, but Taylor's got what we call a deep bite and also an over jet, or a class 2, which means that that lower jaw is too far back. And the reason why it's too far back is again due to that swallow there. Taylor's tongue position, as we mentioned, isn't in the right spot, which is why that upper jaw has been narrowed. And Taylor, do you know what we should be seeing when you swallow around your face? What should be moving?
Nothing.
Nothing. Geez, she's learning quickly, isn't she? She'll get you a job here.
A student.
That's right. Mode of breathing. How should you be breathing? Through your mouth or through your nose?
Through your nose.
Perfect. Very good. And when we get those sorted, that makes for proper facial development as well. And I've also noticed Taylor's posture at times has been a little bit forward. Her shoulders and neck and head have been a little bit forward. And that's typical to see in patients who have their lower jaw a little bit too far back. It does have effects on the way the spine curves. But typically when we bring that lower jaw forward, we start to see the spine straighten up. That's right, that's right. So it has effects for the overall body posture as well. And we talked about those jaw joint problems before. Now, Taylor doesn't have any of these symptoms at the moment, does she? Does she have any jaw joint issues that you've noticed?
Not that
any regular
I've
headaches that
noticed.
you've noticed? No, not
Probably
really.
nothing more than normal.
Good.
but-
Okay. Well, we'll do a proper review at the end anyway, proper evaluation, and we'll assess that. Okay, so the next step is to take what we call records, which is to be able to make a proper diagnosis of Taylor's case. So the records involve photos of the face to diagnose what's happening with the muscles, photos of the teeth to see what's going on with the teeth. We also take molds of those teeth as well, and x-rays to see where all those adult teeth are as well. Now, in terms of the fees, the first consultation is $120 for today. Now, if you wanted that proper diagnosis with those records, it's $200. And then we take those records away and we formulate a plan specifically tailored to Taylor and present that to you at the second consultation. which is $200 again. Now in terms of the fees for our treatment, it goes by age group, and it's a pretty simple concept. The younger they are, the easier it is for us to treat, so that's why we can pass those savings on to you. So luckily Taylor still fits into the kids bracket. You're still a kid there, Taylor. So this 8 to 12 age group here. Now the appliance fee of $2,000 will include anything she'll need throughout treatment. So that's all the Myobraces, all the specialty appliances like the lip trainer, any expanders to make her jaws wider, and even braces if she needs to, if she happens to need that for final alignment. And then it's a $200 fee per month after that for the first 12 months. And then if it does roll on to the second year or beyond, it's normally once every 2 or 3 months, and that's $200 per visit. Does that make sense?
Okay.
Yep. It might be good to show you both the appliance system in action as well. So Taylor fits into this mixed dentition here. Now, this girl had what we call an open bite, which means that when she swallowed, her tongue was poking forwards and it made for a gap between the upper and lower front teeth. And just by controlling the way that tongue behaved, you can see those teeth met again. Because when you get, so you can see how powerful that tongue is. When you control that, then the teeth look after themselves. They just align by themselves. So there's before and after, and that's not by moving the teeth themselves, it's by moving or by correcting the way the tongue was behaving, and the teeth, the alignment, just sorted itself out. So that's what we're looking to do with Taylor as well. Just control the musculature and then the teeth align themselves. Does that make sense?
Yes, it makes a big difference.
It does, definitely. We can get...
Especially in this bottom where you can see the...
That's right, you can see a nice wide jaw there. I mean, we can get very good results for the alignment here. If we look at this case here as well, you can see similar to Taylor, there's some crowded upper front teeth, crowded lower front teeth, again due to swallowing with musculature under that lower lip.
And I think she has that uneven front teeth as well.
That's right, exactly right. Yeah, well, you can see that side tooth there is a little bit behind. Yeah, very similar to Taylor. Now she, as I suspect will be the case with Taylor, she needed to have her upper jaw widened so that there was enough room for the tongue. She wore a Myobrace as well, and you can see the good results for the alignment we can get there. That's right, without braces or extractions there. So it's all down to you, Taylor. If you're prepared to wear these Myobraces and do your exercises like you should, then we'll get a great result for the teeth and make you an even better looking girl. Yeah? Does that sound good? Great. Okay. Would you like to take those records today?
Yes, I think it's a good idea.
Okay, fantastic.